And I think that time has finally come. I think it's finally time for lay people to stop using therapy speak in everyday life to each other.
No, I will not stop using therapy language. Not because I'm a rebel, but because I think it's really not worth it. You can't put the genie back in the bottle. Now, I do see a lot of this online, which is mental health doctors go to the internet and ask not to use the language that they themselves teach. But then when the language inevitably gets out of hand, you then pull back and go, you can't use the language because you don't know how to use it well. You don't know how to use it like I do. But you left your job and came to the internet to teach it, and now you're trying to control it.
I'm literally begging you to please find different words to communicate what it is you're trying to say.
Unfortunately, human race language does not work like that. And here's the thing, language is important to define what you think, and what you think is defined by language. It's a circular system. One informs the other. Therapy language came to pop culture to do is to let us express a few types of cluster of feelings, cluster of symptoms. And when somebody uses that language, what they're trying to express is a collection of feelings, is a collection of symptoms, not in a clinical way, but in an expressive way. When somebody say he must be ADHD, they don't mean the diagnosis, not most of the time. They do mean they have the symptoms, or they are expressing those symptoms, or they have that impression. I say somebody is autistic, everybody knows what type of cluster of feelings, what type of cluster of symptoms I'm talking about. It's a shortcut and it's easy to understand. Diagnose is something that you guys maybe should do.
Just a few months away from getting licensed as a psychologist, I decided to give it all up.
The reason why this matters is that this therapy language came to serve a purpose. It came to teach us what certain things mean. Sometimes people would feel gaslit and they wouldn't have words to express. Thanks to the expression of gaslighting, now people know how to express that. And to try to take that away after giving them a way of expressing that feeling is just gatekeeping nonsense. You can't control language. If you remove language after you give it, what you're actually doing is erasure, and you're trying to erase the feeling. Can't control that. First of all, I have to say, I don't dislike Dr. Anna. I kind of find her vibe interesting because she's kind of gothy, kind of witchy. The only thing I find is that this video was a bit subpar. She didn't think about it. She didn't think it through. But I understand her arguments. I understand that what she has in her mind as she's filming this video. I'm just representing the other side of it, which is why this language will not go away and why this language is actually important for generations to come. One of the arguments is that therapy language escalates conflict and that it allows people to avoid responsibility. The problem here is that the examples that Dr. Anna shows are all funny TikToks. And when I say funny, I do mean comedic. It's people having comedy skits. I don't think this is a real problem. I don't think this is happening, not really. It's almost like the implication is that therapy language is the one making people abusers of language. Abusers will use whatever tools they have to abuse. It's not therapy language that makes the abuser happen. It's the abuser that might take any other tool, including therapy language. That means you have abusive people in your life. You don't need to be afraid of language. That's the wrong conclusion to have here. The problem always goes back to the humans using it. These funny TikToks are just that. They're funny because everybody has misused that language. I'm not saying people don't misuse the language. They do. That's what language does. Literally used to mean literally, and now it doesn't. It means figuratively. It means it's an expression for intensity that is very intense, literally. But they don't mean that it's literal. When I say I'm literally dead, what they mean is I am so shocked. I am so shocked. That's how language works. My core contradiction here.
As a doctor of psychology, my entire education has focused around how to correctly use these terms, and my entire channel is focused on educating other people how to correctly use these terms.
So which one is it? Can we use it or can we not use it? Or can we be educated but then not say a word? Feels like it's a little bit of a gatekeeping moment. You are allowed to use that language even though you're not practicing. We are only allowed to listen to it and never use it. It doesn't sound right to me. And if there's a problem of misuse, why is the solution silence? Bow. Okay, there's an underlying script here that only people who study can use certain types of language. Let me put it plainly. Language is for everybody, and it doesn't matter where it comes from. Now, the diagnose, yes, that belongs to its own scientific fields, but nobody's actually diagnosing. The only thing that this is doing is protecting the script of doctor, which I'm squinting at. There's a moment where she asks for us to use different words, even though we're talking about the same concept.
I'm literally begging you to please find different words to communicate what it is you're trying to say.
The reason they are in use is because they have a need. It's because there's a need. And that's the reason you have a channel, is because there's a need. Then you go ahead and you deny that need, saying only you can use it. But then you teach it. Also, there's some conversation about diagnosis.
I know a lot of people are going to get mad at this, but I'm sorry, I don't believe in self-diagnosing. I really don't. I think it's really risky. I think people often do it erroneously because it's not just about understanding that specific label. You could, for instance, understand what autism looks like very well, but you don't understand the hundreds of other mental health diagnoses that could look like autism.
Again, she's not wrong, fair enough, but people forget that a lot of self-diagnosis is where the diagnosis starts. The moment you hear about ADHD or autism and you wonder, oh, I've been having these difficulties, I wonder if I suffer from one of these, might be what you need to go get a diagnosis. Self-diagnosing is the first step to being diagnosed. In many cases, especially in cases on countries where you have to pay for health. This total separation between doctors and patients is not real, and it's not realistic because life is difficult. And a lot of times, when people can't name things, they don't even perceive it as real. If someone doesn't have the concept of anxiety, they won't have the perception of an anxiety. They just see anxiety as what is normal. I would rather imperfect language than silence. The actual problem is the same problem as always, and it's lack of education. What we need is more education. We need more knowledge. We need more trust in the institutions, more trust in the government. And that trust is not us trusting. It's everything being opened up. It's people feeling like people are being taken care of, that a system has their backs. I don't care if somebody misuses a word, if it ends up and down the line, them being accurately diagnosed with whatever. If it started with them diagnosing themselves, so be it. If it started with them misusing a word, so be it. If people leave a bad relationship because they got the concept of gaslighting inside of them, even if it's not toxic, so be it. Nobody owns language. Nobody owns language. I don't care how many courses, how much of a doctor you are. Nobody owns language. If somebody misuses a word, it's because it made more sense. And then we blame people who misuse the words for miseducation, but then we don't educate. We do videos like this, shaming and gatekeeping. Dr. Anna, I really like you, but this one was a fail. Also, I don't understand. If you want to keep language, If you want to keep language for yourself, why are you in the internet? I have all these doctors coming to the internet complaining about the misuse of language. What are you doing on the internet? Just then go back to your practice then. But I can't believe the expectation is to come to the internet, teach people, and then let them be in silence. These are the ones who left their practices, who stopped helping people, and come to the internet to teach language, and then saying, actually, you can't use it. It's for me to use it. And the audacity that that takes, because then you live from those people. It feels like gaslighting, but I wouldn't know, because I'm not qualified to do a diagnose like that. Or am I? Thank you for watching. Bye.